Hi, I'm here today with Dr. Raj. I'm Ali Harm in the New York office, and Dr. Raj is coming from the DC area. And today we're just going to talk about some really interesting parts of his work that I want to get to know more about. And we're going to start with family expectations, diaspora, immigration, and identity. How does that show up in mental health care for you?
Thank you, Dr. Ali, for having me here. My name is Dr. Raj Sachdej. I am one of the adult outpatient psychiatrists with the Ross Center in the Washington, D.C. area. So thank you for that introduction. And yeah, I take a lot of I take a lot from my own personal book when I grew up, and the idea of intersectionality and that the sum of our parts is more than the whole of ourselves. And so, of course, our background and how we grew up and the cultural expectations of our cultural background, not just in terms of our family unit, but where we grew up geographically, does make a huge plays a huge role in how we experience our childhood, our lives, how the world interacts with us, how we interact with the world. And I personally think that getting to know my patients and how they were brought up is just as important as the conversation around medication management.
Along those lines, something that was on your bio that really caught my attention was your use and appreciation of complementary and alternative medicine, like folk medicine, mindfulness, yoga. Can you share about how that shows up in your work?
Um, I am taking a page from my own personal life as well. I grew up with a lot of, let's say, non-Western ideals around how to look at the body in terms of health, how to approach mental health, and how to view medications. But a lot of what I come across is how complementary or alternative practices might interfere with modern or Western pharmacological practices or treatments. And so we spend a lot of time trying to discern what is going to be helpful, what's not going to be helpful, and then also looking at spending a little bit more time at uh, natural supplements and
Mhm.
looking through reliable databases that I have access to, and making sure that those compounds are not interfering with medications or, and certainly not harming the patients, because there can be a lot of misinformation as well as
Mhm.
poorly regulated supplements and nutraceuticals out there.
I feel like I might need to talk to you about that because I feel like, yeah, as a consumer, you just don't really have great information, and to have someone trusted be able to make sure that everything you're taking is safe and complementary and is indicated sounds incredibly valuable to have.
We are in ways adapting and modifying um, age-old practices to fit Western ideals and concepts. So really just trying to pull from various different treatment strategies and working with the patient to understand what their background is, what is helpful for them, what their understanding is, and then using my expertise to kind of combine all the possible treatment measures that might work best for them.
It sounds really thorough and really thoughtful, and just like the whole person within a whole system and understanding past, present, future, and how to best serve them, and health meaning a lot of different things.
Yes.
Okay, Dr. Ash, something you also do a lot of work in is with the LGBTQIA plus population, and specifically people of color. I'm really interested in hearing more about that.
As it pertains to LGBTQ individuals, specifically persons of color, I believe that population has not had many opportunities to express themselves or feel safe speaking about their mental health and what they've gone through with many other mental health providers. So I believe that I can bring a different and perhaps relatable experience to my patients who are persons of color and identify with the LGBTQ population. It does remove a lot of communication and understanding barriers between me and my patients. If they can recognize across the screen or in the room that they feel comfortable with that person. And so representation and optics around the provider does matter.
Dr. Raj, is there anything else you really want to communicate to any prospective patients out there who might just not know that you would be an excellent fit for them?
Well, Come and try me out. No, just kidding. I would say that a lot of people do come into medication management with a lot of preconceived notions and as well as misconceptions around what medication management can look like. I would like to do in my sessions is not necessarily talk about medications. I would like to get to know the individual, the human in front of me, before I talk about the medications that could potentially be helpful for them. So yeah, you might feel a little bit uncomfortable or a lot uncomfortable talking about your mental health before a doctor's appointment, but understand that we are humans too. We've perhaps been in the same situation, and we want to do our best to make sure that your experience is comfortable and that you get to know us and we get to know you.